All right, what's up, guys? We got Jess in the house for an adjustment today. Say what's up, peace. We got, so Jess is a hairdresser and men's stylist and owns awesome business down the road called the Fade Shop. I have to make it there, obviously. Maybe later. But Jess has had some different issues throughout the body with neck pain, arm pain, wrist pain. A lot of her job duties are what? Like
cutting, arms up and moving all around. So
all around, right? And a lot of like clipping. So it's really common in so many job professions to like hold everything up here. Some of her clients are taller on the chair and lower. So she has, I think, an adjustable chair, which helps the ergonomic posture throughout the day. We've talked a little bit about in the past trying to keep her feet nice and narrow, trying to keep her weight balanced over her feet so she's not kind of like we say, like sloppy, doing anything like sloppy cutting or anything like that, where we're shifting our weight on our hip, which is going to absolutely 100% cause low back pain, knee pain, foot pain, ankle pain somewhere. You'll see her throughout her appointment. She's a really good shoulder roller or a shoulder packer, we'll say. She really kind of throughout the day has been training herself to just get a nice little roll down and back so she doesn't create too much overactivation up in the upper neck, the levator scap, the upper traps, where we get a lot of knots, a lot of fibrous adhesions, a lot of muscle tension that builds up, right? How you been feeling the past? It's been what, probably 3 months?
Yeah, I've actually felt really good.
And incorporating some of the at-home work, right?
Yep, absolutely.
All right. She has 2 kids, an active husband, active family. They camp and what else? Like
we ride dirt bikes, quads, bikes. Yep, everything. We're always outside.
So she's not working, she's moving. And super important to move well. Young in life. How old are you now?
I'll be 30 in July.
And life's going good?
Yep.
Awesome. So
busy.
Started her own place, what, a year, 2 years ago?
Almost 1 year. July will be 1 year.
Wonderful. And booked out with clients, right?
Yeah, like crazy.
Yeah. Sick fades down at her shop. So
the best fade on 19. That's our saying.
All right, the best fade on 19. So lots of EMS, police. You got a good presence in Westview. Mm-hmm. What else?
We support all the military, police, all the local police come in. First responders were very supportive of all of that, and yeah.
So she's got a good following.
Yep.
And we send a lot of our clients down there, a lot of the guys. Not too many girl haircuts though, right?
No, not really.
All guys, right? Yep. So that's where the Fade Shop comes from. Look down for me. But if you're in North Hills, Pittsburgh region, check it out. It's right on 19. And you'll see us today. We're going to do a little bit of arm work on her wrists or forearms, a little bit of neck work to help decompress the neck, get a couple good adjustments in, and she'll leave here feeling pretty good.
I always do.
Always do. Awesome. Her husband beats himself up a little more though, right? He's got a little tougher job of
digging ditches
and township work and sometimes on call, right?
Yep.
Look down for me. So you guys, we're doing a little myofascial up to the upper cervical spine, just to help loosen up the suboccipital muscles a bit, kind of right up under the mastoid process. We'll talk a little bit because she's got a little tension over on the right side, but right up here you have your mastoid process, which is part of your skull, your occipital bone back here, and your eustachian tube, which is your ear hole, kind of drains down right into like the back of the throat, right into like the posterior neck right here. So it is common to have a lot of tension in the back of the neck. She doesn't have a bunch, just a little bit. But if you do get really tight and kinked up in the back of the neck, you can have ear pain. You can have otitis media or a clogged, infected ear, an earache. Look down for me, or an ear infection if you get bacteria and other stuff down there that your body doesn't like. So one of the things we'll do is drain the mastoid air cells and the base of the skull right here, just with some hands-on manual therapy to reduce muscle tension and just help get fluid moving down out of the ear. So chiropractic care is really effective for ear infections. If you're getting chronic ear infections on the right side or the left side, that's a big indication that you also have a kink, a sprain, or an irritation in the upper cervical spine that can cause the eustachian tube to get a little jammed.
I always give Dr. Dan all the credit for both my kids. They've never had an ear infection, neither of them. They've both been seeing Dan since they were just a few days old. So
good, thank you. Yeah, and that's awesome. Like, so many kids will have 3 or 4 right side ear infections, and they'll take antibiotics and they'll suffer through the discomfort and the pain of the clogged ear, but never really address the root cause unless you get to a chiropractor that can help kind of adjust and loosen up the kids' necks to help reduce the pressure up in the eustachian tube. So look into it if you're into it. If you want to avoid the antibiotics and generally raise kids that are ear infection free, look down for me. Look down for me.
Keep down?
Just up and down. Up, down. Up, down. Up, down. Up, down. Up and down. And up and down. One of the things in her job duties, in her profession, we see so many guys and girls that are 40s, 50s that have carpal tunnel, and they have this chronic numbness and tingling down into their fingers. And, from, again, job duties, clipping and cutting. And
yeah, even through my pregnancies, I didn't have to deal with any of that because I saw you through both of those as well. A lot of women deal with that in my industry with when they're pregnant, getting the carpal tunnel.
Yes, and even not in your industry, like that's a good point. Carpal tunnel is prevalent due to, let's look down for me. So now, guys, we're going to work on the levator scap, the upper back a little bit. Look up straight, look down straight, look up straight, look down straight. Look up straight, look down straight. And this is kind of like one of our sweet spots. We hit it on all the patients, right up around the shoulder blade, the medial border of the shoulder blade. Look up, look down for me. Look up. So you'll see this in every video. This is such a high tension spot for so many people. Look down, look up, look down. And when we talk about the lymphatic system, which we've done in some other videos, so many people plug their system up by tight neck, tight shoulders, right? So we really want to work that back and down. That helps open up the pathways, the channels for fluid to drain, for bacteria, viral infections in the lymphatic system to drain down. Jess can stretch her head to the left here. And again, you guys will see a little bit of the striation right here in the scalenes, the upper trapezius muscle. And so throughout the day, it's important for her to just kind of passively, gently stretch her neck, pull her ear away from her shoulder. Think squeeze this guy down more, and feel how that kind of just pulls right through here a little bit. So really easy and simple to incorporate some at-home work outside the appointments, so we can just kind of continue to loosen up some of the stuff up here around the side or the lateral portion of the neck. Let's go back to center. Look up straight, look down straight. Look up straight, look down straight, look up straight, look down straight, look up straight, look down straight, look up straight, look down straight. But 2 pregnancies, right?
Yep.
And kids have been pretty healthy since.
Yep.
They are adjusted a couple times a year now. We try not to over prescribe unless necessary adjustments. So we'll see our kids maybe once every 2 or 3 months. I know she's pretty strict at home with some of the seated postures and some of the different exercises, like foot placement and foot position that we recommend. Parents try to kind of coax their kids into sitting correctly, because good habit forming right now at young age, super important, right? So making sure the kids are standing decently straight. And we talk about programming the kids just like you program them to brush their teeth daily, to eat generally healthy foods daily. We also want to program their body and their mind to stand straighter, to sit correctly, because this is education that we don't get in schools. And so many kids develop poor postural habits at a young age because we go to school for 8 hours and we sit there all day long. We don't stretch correctly. And then all of a sudden you're like 20 or 25 or 30 with some back pain, neck pain. And it's all linked way back to how you did things as a child. So all the parents that come in here, we're pretty adamant about take a look. If the parent has knee pain or ankle pain, we also say, be mindful of how your kids are also doing their day-to-day habits and incorporate some of the same exercises into your family life and your children's life at home. Good.
My kids are also always barefoot.
Always barefoot. Yeah. Awesome. Barefoot outside, barefoot in the grass, barefoot on the concrete, for everywhere for small nerve stimulation down into the feet. And it allows kids' posture to form so much better if the kids can feel the skin on the feet and feel the environment with the skin down on the base of the foot. Good stuff, man. You're just rolling with it today. Look down for me. All right, cool. All right, let's go face down on the table for me, all right? So we're gonna do some leg stretching with her. And I know in the past she's had some right calf, right foot issues. She can feel the tone when we squeeze the calf here versus over here. Do you feel this like spot right in here?
Absolutely, yeah.
Absolutely. So she's had some chronic like right foot, right toe, kind of like turf toe almost. Like,
yeah.
What was it, your second or third toe?
Yeah, my second and third toe. You'll see there's like a gap in between. I've had issues with that ever since I danced for 18 years. So so I actually got cortisone injections into my toes when I was younger, and it's caused extreme like scarring and issues throughout there.
Yeah. So what we're feeling is the tone of the calf muscle right through here. She's got a massive, feel that thing right in there? Mm-hmm. She's got a pretty significant, right over the coloring of the tattoo right here, pretty significant calf trigger point / strain, a little bit of fibrosis right here in the popliteus muscle in the back of the knee. And so one of the things we're gonna do, just some general myofascial back here to help stimulate some of the fluid in the back of the leg, as well as just a little bit of pressure into the muscle will help it calm down. Jess has been working on some foot squeezes, some plantar flexion exercises to help strengthen the plantar fascia. We also get into some calf strengthening as well as stretching to help balance out the muscles in the back of the leg. But this is already releasing nicely. Now it's a little lower right here. We're gonna just run right over that. Tattoos on the body. When you get a tattoo, if you have a tattoo, you know the sensation on the skin, but it can also create, and probably not so much in her case, but it can also create neurological over or under activation. So muscles can kind of get wired differently. You can have deep muscular fascial injury from tattoos. So once the tattoos heal and you're able to, start working on the skin again, it's important post-tattoo to get some work done. And what we're doing, just some deep, she's doing a great job just breathing comfortably. If you guys ever get a massage or ever get worked on, you want to, if you ever get massaged, if you ever get worked on, you want to try to prevent your body from tensing up. Like if everybody's ever pressed on your muscles and they've been really tight, like it's common to go like, oh, that's kind of like sore, right? But diaphragmatic breathing, kind of meditation almost, closing your eyes, getting deep down into your brain, into your body, focusing on some abdominal breathing will really help the body to calm down and make the massage, the muscle work much more effective. And she's doing a great job. She's not fighting against any of the pressure through here. This calf is already loosened up pretty nicely. She's got one more little spot right here.
I'm not fighting against it because it feels amazing.
It feels amazing, right? And your body will tell you like, oh, that's good pain. And a lot of the myofascial muscular tension spots, the trigger points, the injuries, your body will say, I want you to press on that. It causes pain, but it's like that good kind of pain. All right, good work. Now, you see when we stretch her heels out, one of the techniques that I like to utilize just to check the internal rotation of the knees and the hips is just a little heel press out. Her left side moves well. Her right side's just a little stiffer. And what we know when the right side's a little stiffer on that internal rotation is that, again, and it's so common up in the hip and up in the upper back or the lower back, the lumbar spine, where we'll get some sacroiliitis sacro meaning sacrum, iliitis meaning just inflammation of the sacrum. And she's got a little spot over here in like the right hip, which so many people have in the right side. Most of us are right foot dominant, but also a lot of our activities throughout the day, especially driving in the car. So many people will drive in the car and they'll turn their right foot out, which causes the low back up in the right side to kind of just tighten up and get a little jammed up, a little kinked up right there. So one of the techniques and one of the tips that we like to utilize with the chiro patients, we teach them how to drive with their foot straight on the gas and internally rotate or turn the toes in for the brake. And then we're using a hypervolt just right around the hip crest, around the sacrum, up around the ilium. The ilium is your hip bone. It's kind of like your elephant ear bone. So there's one that goes this way. There's one that goes this way. The sacrum's right here in the center. And I like to treat using the hypervolt here. I don't use it too much on the lower glutes, but mainly the upper glutes. The glute med, the TFL called the tensor fascia lata, and the sacrum right through here. And then we just transfer to do a little bit over on the left side. Sometimes this can be a little ticklish. Sometimes it can be a little tender. Either way, ticklish or tenderness is an indication of over or hypersensitivity to the area. As we balance the muscular system out with different exercises, which start down in the feet, a lot of the tension up in the hips will dissipate. If you've ever been a person that's had that like super bad sprain or strain, like I can't bend over anymore because my back is so tight or my back is so painful, that's an indication that you have a lot of tension built up in these regions and you need to get it worked out. And then we'll just go right across the LS border, the lumbosacral border right here, right where the L5 vertebrae meets the lumbar, the L5 vertebrae meets the sacrum. And then just right up and down the SI joints themselves, the sacroiliac joints. This is a great technique. She's not pregnant right now, but anyone, one or any woman that is pregnant can get a lot of like lower back and pelvic pain as the hormones in the body change, as the baby grows. It is safe in our office. We'll do it very lightly around the pelvis to help relieve tension here. A lot of women love the feeling of it. A lot of guys love the feeling of it. It'll help release so much tension down in the pelvic floor when we just treat with the hypervolt right over the SI joints. Awesome. My hand here. Stop. So you guys see how flexible she is down in heel to butt or medial border of foot down into butt. Push for me. Stop. So we know that she's got minimal push and stop. And push and stop. And push and stop. Minimal quad overactivation. You guys will see some guys on the YouTube channel that can only get their knee like here because their quads are so tight or overused or underused. Either way, they're imbalanced. Push, stop, push, stop, push, and stop. Awesome. Good. Back down. All right, then we're gonna do a little muscle work on primarily the right side lower back. Raise this up here, and we're just gonna roll this down like this. Raise this up a little bit, all right? Right up to like here. Cool? Yep. Right there. Fine. And then in the lumbar spine or the low back right through here, we'll typically do more muscle work in the low back, the lumbar spine, and then the CT junction up here. The mid back, unless we've got some rib sprains or something like that, we don't typically do a lot. We focus just more on the adjustments in the mid back, unless somebody's got a big nasty trigger point or an irritation up in the erector muscles. A little less common from what we find in the office. But definitely in that low thoracolumbar fascia, which is this stuff down here, a lot of people will get a little bit of sway back posture, and that low back gets a little tighter than it should. Also important to note, that diaphragm breath. Can you try to take a belly breath in for us? Awesome. Exhale out. And let's do that again and just kind of hone in on her obliques right here as they fill up with air. Exhale out. And deep breath in. Perfect. You guys see how those obliques are working nicely. A lot of people will also develop tension like up around the kidneys right up here. A lot of diaphragm tension can, or rib muscle called the intercostal muscle tension can develop in this posterior flank region. Some people confuse it for kidney irritation or kidney infection. If somebody is having significant pain in this region, generally we're going to refer them out just to make sure nothing's wrong, nothing's clogged, there's no stones up in the kidney. But so much more often than not, people are just having like intercostal strains and sprains from improper breathing or back and core stabilization. And Jess has a little bit right here, just a little spot in the low back. Over the vertebrae. Nothing too tender though? Awesome. So you guys could see how well her legs stretch out. Some of the other patients we have on the YouTube channel, you'll see how their legs are much stiffer. They're going to be a little more at risk for low back pain, hip pain, knee pain. They have a little more rehab work to work on. She's been doing a lot of her child's pose, a lot of her rocking position, I think, at home, correctly sitting down on the knees with the feet and the toes tucked in. All right, good work. All right. And again, like you'll hear me say in other videos, the work outside the office is so important. All right. All right, thoracic spine time. Take a deep breath in. Exhale out for me. Whole way down. Whole way down. Good, good, good. Deep breath in. Exhale out. Whole way down. Deep breath in. Exhale out. Whole way down. Awesome. 3, perfect. Nice movements up in that thoracic spine. Face over to the window, right side up. Bottom leg straight. Right here. All right, cross here. Deep inhale. Deep exhale. Whole way up. Whole way up. Good. Other side. Right there. Right here. Right here. Deep breath in. Exhale out. Good. Flattening your back. Sometimes if we don't get everything to move, we might do a little double tap like that. The little double tap will help us just get some more movement in that lumbar spine. Everything's moving well. In the low back. Oops. Now we're gonna do a little toe work down here. You guys will see sometimes we'll just get a little paper towel on the toes just to get a little better grip.
I see a huge difference between the left and the right.
All right, good work, good work. That's good. One here. Good. All right, heel down. There's ankle. There's ankle, good. Those are called the mortise joints, the ankle mortise joints. And then we finish with a little bit of kind of like extreme plantar flexion. So if you guys have shin splints or you know somebody that has shin splints, that's caused from an overactivation and overuse, sometimes a weakness of these tibia anterior and peroneal muscles. So when we plantar flex, you guys can see how we get a nice little stretch right here with the vein, a little bit of stretch out in the synovium or the connective tissue in the lateral ankle. One of the things we'll recommend that our patients do at home is a lot of like foot squeezes. So curl your toes down, Jess, for me. And let's focus left foot down and in a little bit. Perfect. And then right foot down. So if you guys have kids or if you have babies, you'll notice when 0 to like 6 months, and even Taylor, my little girl's gonna be 2 years old now, but she, throughout the day, you'll just see her like point and stretch her feet so nicely. This is one of the exercises that helps prevent us from duck walking, right? So if we walk duck footed, let's put the feet up and out this is your duck foot walk. So many people have these like crooked hammer toes where the tendons on the outside of the legs get so tight. So back when I was in track and field back in 7th and 8th grade, man, I had to like take some weeks off because I had shin splints. One, I wasn't running correctly, and two, my whole lower extremity, my hips, my core, my legs were so far out of whack, right? So toes down and in, gentle knees open. This is your double bow set foot flexion exercise. In her brain, she's going to focus a little bit, about 10 seconds on the left foot squeeze. You see how her calf activates nicely. And then the right foot squeeze, you see how she's got that nice right calf activation. So strong legs, strong feet is going to create strong hips, strong low back, and then strong spine. And it all starts down in your feet. That's why we recommend barefoot training in the gym. You'll see some of our videos. We don't really wear shoes. We wear socks or even sometimes barefoot. As much barefoot health as you can at home. So if you're walking through your yard, if you're playing with the kids in the yard, go barefoot. It's better for the ankles. It's better for the intrinsic muscles of the feet. So here's a good little key point. Let's do that again. Let's just point out, if you guys can tell, the first interphalangeal joint right here, the second, the third, this right foot right through here. And again, I don't know if this is a result of this little tattoo right here, but these 3 digits are just a little elevated. And this is where she's going to get like some periodic plantar fasciitis and just kind of like foot pain. You can get neuromas down in the feet, which are little nerve irritations. But for her, stretching her toes down and in like this is so important to reduce tension on this top side of the foot. Other things that can help, you guys may have seen some of the videos for the Nervoso Neuro insoles, the insoles, which help stimulate an outside environment in your shoe. Go ahead, stay right down here. And then the other thing, just stay right down. And then the other thing are correct toes, or like yoga toes or toe spacers.
It's good.
What's that?
Is it sorry, evolution?
Good. 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 Now elbow. Relax that wrist right there. Good. All right, good. Elbow's good today. Arms are feeling good.
Pretty good.
Been good?
Yeah, decent.
Yeah. Stretching the wrist a little bit, right?
Yep.
So again, sometimes we'll use a little paper towel. My hands have a little lotion on them. Her hands have a little lotion on them. Sometimes the skin gets a little slippery. Good. Good. Wrist. And then forearm. That's good too. All right. Good work, man. Hands on thighs. All right. Cervical spine. Shoulders down for me. Turn to the right. Relax here. Left here. Relax the shoulder. One more hand on the left side. All right, that's good. All right, sit up tall for me. Spin to the right. So we're going to finish her appointment up. We got her thoracic spine adjusted, her lumbar spine, ankles, feet, wrists, fingers, elbows. We'll do her shoulders to finish up with. She really doesn't need this today. She's been doing an awesome job over the past, man, you've been a patient how long?
We were just talking about this actually, I think like 10 years.
10 years. Oh, wow. Time flies, right?
Yeah.
So
insane.
10 years is crazy. If you incorporate the at-home work that we teach, it helps to really just not need adjusted as much. It feels awesome. We do have patients that come in every week, every 2 weeks. They love getting adjusted. They don't, maybe they don't put in some of the at-home work. Some people just don't like doing mobility work. They don't like stretching themselves, so we'll help them to achieve it. But Jess has done an awesome job over the years of improving her body posture. She's been mindful at work. But with hairdressing and really just any forward movement of the arms, carpal tunnel, nerve entrapment, the median nerve, the ulnar nerve, the radial nerve, which is on the top side of the arm. So common to get nerve irritation and subsequent numbness, tingling, or weakness, carpal tunnel down into the fingers, the wrist, or the hand. So we're just showing you guys here. This is a general. What we're using here is a rock tape, one of the rock tape rock blades, they're called. And there are so many different instruments or tools that are available now that will help you. You guys can even purchase a lot of them on Amazon now, called like gua sha tools. Graston was like the original guy, but fascial treatment like this helps, as you see, to just get some blood into the connective tissue and the musculature. And so we're going to get a general, just a light red reaction with her. but she's not in here complaining of like medial epicondylitis, which is golfer's elbow or tennis elbow out here. But this is one of the techniques that we'll utilize. A lot of chiropractors, physical therapists, athletic trainers. Sometimes you might see some of the pro guys on the side of the field having this done. But this is a great way to help reduce myofascial restrictions and just promote circulation down into the joints of the body. All right, let's do the left arm now. And then let's drop this down. Good. Lean or pull your head over to the right, like that.
I don't know if you remember, but whenever I first started coming to see you, I had really, really bad shin splints and used to do like this to my shins.
Yeah.
I haven't had issues with that in a long time. Or
Yeah.
since then, actually.
Oh, that's awesome. So you guys will see like right here how that gets a little redder right there, but also listen. So you can hear a little bit of the scraping underneath there. And this is where she's just got a little restriction. You can see how that spot gets a little redder right there. Not so much down here, right here over the tendon. You see that little guy right there. It's a little vein underneath the tendon or over top of the tendon where we'll get a little restriction at. All right, good work. All right, there we go. Let's wipe that off. So one of the lotions we use here, it's like a heating cooling lotion. She's got it on both arms. She's gonna step outside. You might get the shivers.
Yeah.
Because your body's gonna be pretty hot, sometimes cold. The lotion's really awesome. It kind of lasts for like 6 to 10 hours. And it really just helps kind of soothe the muscles. Sometimes it gets a little burny though. So later on in the day, we recommend, or we'll tell her, hey, if you notice that your forearms might be burning a little bit, that's okay. If you need to wash it off, go ahead, raise this up. One more here. Awesome. All right, guys, good work, dude. That's Jess, hairdresser. We did some arm work, full spine adjustment, ankle adjustments. Elbows are already moving well, so they don't really need to adjust or pop or anything like that. But feeling good?
Yeah, feels awesome.
All right, we will see you in a couple months. Thank you guys for watching.